Hello everyone. In this lecture we are going to discuss about oligohydramnios, and it is a pregnancy condition, and this term refers to a condition characterized by a reduced amount of amniotic fluid. Reduced amniotic fluid. So let's see what it is all about. It is the reduced amount of amniotic fluid. And what is amniotic fluid? It is the fluid that plays a crucial role in the development and protection of the fetus. And it is the fluid that the fetus is submerged into. It provides buoyancy, cushioning, and helps regulate temperature, as well as facilitating fetal lung and musculoskeletal development. And all of these conditions are provided by the amniotic fluid. If the amniotic fluid is reduced or the amniotic fluid is absent, this is called the oligohydramnios. How can we diagnose oligohydramnios? The diagnosis of oligohydramnios is typically made through ultrasound examination, which measures the amniotic fluid volume using various methods such as amniotic fluid index AFI, amniotic fluid index, or the single deepest pocket SDP, single deepest pocket measurement. What are the potential causes? What are the potential causes of oligohydramnios? They include decreased fetal urine production. Decreased fetal urine production. The kidneys of the fetus produce urine, which makes up a significant portion of amniotic fluid. Reduced urine production can occur due to fetal abnormalities affecting kidney functions. And number 2, rupture of the membrane. The amniotic sac may rupture prematurely. The membrane of the amniotic sac. The amniotic sac may rupture prematurely, leading to a leakage of amniotic fluid and subsequent oligohydramnios. Number 3 potential cause may be placental insufficiency. Inadequate blood flow through the placenta can affect fetal urine output and amniotic fluid volume. Number 4, there might be some maternal complications. For example, preeclampsia, hypertension, diabetes can contribute to oligohydramnios. Preeclampsia and hypertension. If the mother has hypertension, then she may use ACE inhibitors or other antihypertensive drugs. These drugs can lead to oligohydramnios by reducing the amount of fluid around the fetus. How can we manage the oligohydramnios? The management of oligohydramnios depends on the underlying causes. For example, gestational age and fetal well-being. Treatment option may include dose monitoring. It is very much important that what are the doses the mother is being given, and also she has to be in close monitoring. Then increased hydration. We have to increase the hydration of the mother. Bed rest and medications to stimulate fetal urine production. We have to increase the fetal urine production. Fetal urine production. In severe cases, early delivery may be necessary to prevent complications associated with oligohydramnios. oligohydramnios. So these are the management of this problem. It is important to note that oligohydramnios can have significant implications for fetal health and development. It may lead to complications such as fetal growth restriction, umbilical cord compression. This is very severe. Umbilical cord compression, so that reduced amount of fluid and nutrition can pass through it, and the fetus may be affected by this phenomenon. Fetal distress during labor and an increased risk of birth defects. Therefore, it is essential for pregnant individuals diagnosed with oligohydramnios to receive appropriate medical care and regular monitoring to ensure the best possible outcome for both the mother and the child. And this is all about oligohydramnios. We will see you in later videos.